I'm a social worker by trade.
Okay.
I am not a nurse. So, and I think that's probably one of the big misnomers about case management is that most people who are directors are assumed to be nurses. I am not a nurse. I am a social worker by trade. So one of the things I loved about it when I went to one of the ACMA conferences, before we started talking with MCG, I went and did a demo at the conference. And the conversation I had with the gentleman he was so funny at the time, but just the ease of the system, the ability for someone I'm a clinical social worker, but I'm not a nurse, to be able to navigate through, the rapid recovery guidelines. This was before Indica or the chronic care guidelines. I found it to be very easy to use, very easy to interpret, and it kind of empowered me. So when I took it back and started really looking at it, and when I attended rounds and things along those lines, it helped me from the clinical standpoint of understanding that dialogue that goes on between the physician and the nurses, when it comes to, care of a patient and things, and what does this all mean and things along those lines. So I found it beneficial from my standpoint of really learning this aspect that I wasn't trained in, because I was trained in a very different arena in a hospital. But then I also am able to do my own reviews. If I really want to do one, I could go and do it myself, which I think is pretty cool.
Yeah.
It's not just, so you really don't have to be a nurse to be able to do a review, because I do have some other social workers that I've had them say, hey, try this out and tell me and give me some feedback. Tell me what you think, and most of them enjoy it. And I said it kind of gives them a very different aspect of patient care, where it's not so much, social work centric, but it's also looking at the clinical component of those pieces that happen inside a hospital, which is cool.
Yeah.
Very cool. Yeah, very cool.